All right, today we're going to be doing a neurological assessment. First, I am going to perform hand hygiene, um, offer privacy to the patient, and then I'm going to introduce myself. Hi, my name is Haley. I'm going to be your nurse today. Can you let me know your name, please?
My name's Jacob Tarbox.
All right, and your date of birth?
May 26, 1998.
And can you tell me the season?
Spring.
All right, and I just asked him all those questions while looking at his name band. If any of those questions were to be wrong, we would stop right there and assess him further for any other cognitive defects that he may have. If he were to say it was summer when it's 40 degrees outside, that would be an issue. So then we're going to start off by assessing the cranial nerves. We're going to start off with cranial nerve number 1, which is the olfactory. Olfactory is associated with smell. So I'm going to ask the patient to close his eyes. And can you occlude one nostril? Can you breathe in for me? What are you smelling?
Lavender.
All right. Can you do the same to the other nose? Breathe in.
Lavender again.
All right, and he's able to properly identify the smell. This is really important to do with safety, because if he were to live by himself and was not able to smell at all, he could have a gas leak in his home. He could have a fire, and he would have no idea because he cannot smell. All right, and then next we are going to assess cranial nerve number 2. This is the optic. And I'm going to test his peripheral vision. So I'm going to ask him to close his eyes. Oh no, close one eye, I'm sorry. All right, and can you let me know what number I'm putting up? Just keep your eyes on my nose.
2. 4.
Other eye, please. Thank you.
1. 3.
All right. And that is to make sure that his peripheral vision is intact. And then we would do a Snellen chart. If I had a Snellen chart here, I would do it, but we do not. And with the limited space, I would have him stand 20 feet back from the chart that would be on a wall, and I would ask him to cover one eye and transition, and then none at all, and have him read farthest down the Snellen chart as he could. This measures any deflects in the eyes, whether one is stronger or weaker than the other, so we were able to correct that. This is also another safety. As for someone who is older, that's a big issue. They should be able to see what's in front of them and able to, in order to walk properly. We want to prevent fall risk. And then we're going to be assessing cranial nerve 3, 4, and 6. For the involuntary shaking of the eye, or nystagmus. We are going to do this by taking a pen light. Can you keep your eyes right on this pen tip? We're doing a 6-point test right here to make sure the muscles in his eyes are working properly, so he is able to move his eyes as he needs to, so they're not drifting off. And then we would make sure his eyes are able can dilate upon light. This is really important for safety. My throat. This is really important for safety because we want to protect the eyes, and that is the eye's self-defense against light. We don't want to damage our eyes from the light. So if I can have you look at my nose, please. His eyes started off, both of them at 3 millimeters, and they went down to about 2 millimeters, which is good for a dilation. And then we want to make sure his eye muscles are working once again. If you can just stare at my finger. His eyes are crossing, which is a good sign. He is able to follow direction and the tip of my finger. And his eyes are perla, which is also another way of documenting that they are well. And then cranial nerve number 5, which is used for mastification. I'm going to test to see whether these muscles are intact. Can I have you clench your jaw for me? All right, and I feel his masseter, and I feel his temporal muscle. That means he's able to properly chew his food. All right, and then I'm going to have you open your mouth against resistance, so I can have you open it. All right, and he's able to open his mouth, which shows strength in those muscles. And then cranial nerve number 7, I am going to ask you to, this is the facial nerve. I'm going to ask you to close your eyes tightly. Open, smile for me, frown. And then puff out your cheeks. This is a quick and easy way to test all of the facial nerves quickly. It hits pretty much every point. And then I'm going to ask him whether he is feeling a blunt or a sharp object. Can I have you close your eyes, please? Here I'm taking a sharp object, and this is my soft object.
Blunt.
Sharp.
Sharp. Soft. Sharp. Soft. Sharp. Soft.
He correctly identified everything that he was feeling on his face. This is really important. Did you feel any stinging or stabbing?
No.
No. This is also really important because we want to make sure that there's no hypersensitivity to his face. Someone with hypersensitivity or a neurological issue would feel a stinging or stabbing pain upon a cotton ball being put on their face, which is not the right reaction. And then I will be doing cranial nerve number 8. So I'm going to occlude his one ear and whisper something and have him identify it.
Apple, banana. Soda can.
All right, and he correctly identified both of that, and that's all of these are pretty much making sure he's safe. If he wasn't able to hear, he wouldn't be able to do a lot of things. Speaking would be an issue, conversing. And then we're going to be doing cranial nerve number 9, and this is to make sure he's okay to swallow, making sure he doesn't aspirate, and making sure the uvula is moving correctly. Can I have you open up your mouth and stick out your tongue and say ah?
Ah.
His uvula moved upward, which is a good sign, meaning that the muscles in there are working properly. And then, oh my gosh, I need a drink. And then I would test his gag reflex. And by doing this, I would stick that down, touch his uvula just slightly. I'm not going to do that to him today. And this is also very important because someone who has an absent gag reflex is at risk for aspiration. And then cranial nerve number 10. We've been assessing this the entire assessment. He is able to speak to me properly. He was, there was no reluctancy in answering me, no thinking, he just spoke. And then we're going to be doing cranial nerve number 11. This is the spinal accessory. If I can have you just move your head up and down, left to right, and shrug your shoulders. All right, he was able to perform all of those activities. He even used those spinal accessories against resistance. And both sides were equal when he shrugged his shoulders. And then cranial nerve number 12. This is the hypoglossal. Can I have you stick out your tongue, please? and move it side to side. This is also very important in mastification to make sure he's able to take the food from his cheeks and swallow or chew. And then that is it for the cranial nerves. Now we're moving on to the motor system. I'm going to be assessing the strength in both of his upper and lower extremities. So I'm going to do this by having you, can you squeeze both my fingers at the same time? All right. Place your hands like this. Can you separate your hands? How about pull them together? All right. And hands like this. Can you push up? Can you push down? All right. And he was equaling strength upon resistance bilaterally. And now I'm going to do passive range of motion exercises. So don't move your arm for me. I'm going to move it for you. I am moving his arm. If he were to have Parkinson's or maybe another kind of neurological issue, his arm would not be able to extend this much. It would be contracted into a 90-degree angle or smaller. We want to pull that apart and do this on both sides. There's no resistance. I'm able to easily move his elbow and shoulder, which is a very good sign. We don't want to, with the resistance, there's no single-sided weakness. He's able to perform everything correctly. And then I'm going to be assessing rapid movements by asking him to move his hands rapidly. Can I have you place your hands with palm down and repeat what I'm doing? Can you do that as fast as you can? All right. And he performed that easily with no resistance. Someone with Parkinson's or a stroke would not be able to move one side, or there would be resistance or slowing. It wouldn't be that fast. And then I'm going to be assessing coordination. So if I can have you lay on your back, please. All right. And if I can have you take your right heel and bring it to your left kneecap and follow it down your shin bone to your left ankle. Can I have you do the same with the other? He was able to follow direction, and they both seemed fine when performing this task. And then I would ask him, can you please stand up for me, please? All right, and face towards me. All right, looking at him, he isn't swaying back and forth. He seems fine. And then I would do what we call the pronator drift. Can I have you close your eyes, please? And stick your palms forward. Yes. And I'm going to push down. Keep your elbows locked. He's moving back to his original spot. If he were to have some neurological issue or weakness, I would push down and keep it in place. He would stay like that because his eyes are controlling where he's placing his hands if he were to have a neurological disorder. All right. And then I'm going to do some sensory function. So if I can have you sit down on the bed for me, please. All right. And this is called graphesthesia. I'm going to write a number on his hand, and he's going to identify which number. If I can have you close your eyes, please. Just let me know what number.
7.
I'm going to do this on each side to make sure there's no numbness.
3.
All right, perfect. And then I'm going to be assessing sterganosis. So I'm going to hand you 2 objects. and you're going to tell me what is in each hand. You can feel it, whatever you need to do to identify it. So I can have you close your eyes. Open up one of your hands. Close.
Bobby pin?
Mm-hmm. All right, and open up the other hand.
It's a coin.
Yes. That's to make sure that both sides of the body are able to identify objects just by feeling them. Some people can't feel, they can only see. And then this is called tactile agnosia, when they're not able to identify. And the definition for that is the inability to perceive and recognize object by touch. And if I can have you lay down for me, please. I'm again going to test some sensory, but in limbs. If I could have you close your eyes, please. Let me know whether this is a sharp or soft object.
Sharp. Soft. Sharp. Soft. Sharp. Soft.
All right, and this is very important in diabetic patients to make sure that they still have feelings in their extremities due to lack of circulation. All right, and that is all for our neurological assessment.